How to determine if you had a miscarriage. Miscarriage, also known as spontaneous abortion, occurs when a pregnancy fails to progress before 20 weeks of gestation. Miscarriages are common, impacting up to 25% of recognized pregnancies. 1. To determine if you had a miscarriage, you'll need to evaluate your risk factors and monitor symptoms like heavy vaginal bleeding and pain. It can be difficult to determine if you had a miscarriage since some symptoms also occur in healthy pregnancies, however, so you should seek medical confirmation if you think miscarriage is a possibility. Always follow your physician's advice if you think you have suffered a miscarriage. Miscarriage causes and symptoms. Understand why miscarriages happen. Miscarriages most often occur in the early weeks of pregnancy. Chromosome abnormalities are the most common cause, and in most cases there's nothing the mother could have done to prevent it. The risk of miscarriage drops after 13 weeks of gestation. By then, most chromosome abnormalities would have already caused the pregnancy to end. The following factors put people at higher risk of having a miscarriage. Older women have a higher risk. Women who are 35 to 45 years old have a 20 to 30% chance of miscarriage, and women over the age of 45 have up to a 50% chance. Women with severe chronic illnesses, such as diabetes or lupus, have a higher risk of miscarrying. Abnormalities in the uterus, such as scar tissue, can lead to a miscarriage. Smoking, drug use and alcohol use can cause miscarriage to occur. Women who are overweight or underweight are at higher risk. Women who have already had more than one miscarriage are at higher risk. Check vaginal bleeding. Heavy vaginal bleeding is the most common sign that a miscarriage is occurring. It is often accompanied by cramps similar to those you might feel during your period. Light spotting, and even moderate bleeding, can occur in healthy pregnancies. Heavy bleeding with clotting may indicate miscarriage. Notify your physician any time you experience bleeding during pregnancy. According to the American Pregnancy Association, 50 to 75% of miscarriages are chemical pregnancies. This means they occur shortly after implantation. Often, the woman does not realize she was pregnant and she experiences bleeding at the time her normal monthly period is due. Bleeding may be heavier than normal and cramping may be more severe. 5. Check your vaginal mucus. Symptoms of miscarriage include pink-white vaginal mucus, which may contain pregnancy tissue. If your discharge looks like clotted tissue, or is solid in any way, this may be a sign that miscarriage is occurring or has occurred. You should see your doctor right away. Most pregnant women experience increased levels of clear or milky vaginal discharge called leukorrhea. 6. If you have high levels of this type of discharge, there's no need for alarm. You may also mistake spot of urine for vaginal discharge. Urinary incontinence is a common occurrence in healthy pregnancies. Pay attention to your aches and pains. Any pregnancy brings a variety of aches and pains along with it. During a miscarriage, pain is usually located in the lower back and can range from mild to severe. If you experience lower back pain, talk with your physician right away. Occasional twinges or aches in your abdomen, pelvic area and back are often the result of your body adjusting to accommodate your growing fetus. If pain is severe, persistent or occurs in waves, you may be miscarrying, especially if there is also bleeding. It is also possible to experience true contractions if you're having a miscarriage. The contractions occur every 15 to 20 minutes, and are often severely painful. 8. Analyze your pregnancy symptoms. With pregnancy comes a slew of different symptoms, all caused by increased levels of hormones in your system. If you experience a reduction in symptoms, this may be a sign that a miscarriage has occurred and your hormone levels are returning to their pre-pregnancy state. If you've had a miscarriage, you may notice less morning sickness, less swelling and tenderness of the breasts, and a feeling of no longer being pregnant. In healthy pregnancies, these early symptoms often subside on their own at about 13 weeks, which is also the time miscarriage risk decreases. Symptom occurrence and severity varies in every pregnancy. A sudden change prior to 13 weeks warrants a call to your physician's office. See your doctor to be sure. Visit your physician's office, emergency room, or the labor and delivery area of your hospital for a definitive answer as to whether you miscarried. Even if you experience all the above symptoms, there still may be a chance that the fetus can survive, depending on the type of miscarriage. Depending on how far your pregnancy has progressed, the physician will use blood tests, pelvic exam or ultrasound to check the viability of the pregnancy. If you experience heavy bleeding early in your pregnancy, your physician may not have you come into the office unless you wish to do so.